Welcome to Connective Care Education. In this video, we are going to look at the content for Unit 003, Learning Outcome 12, Dementia. Introduction. According to the Oxford Dictionaries, the definition of dementia is a chronic or persistent disorder of the mental processes caused by brain disease or injury and marked by memory disorders, personality changes, and impaired reasoning. Dementia is an overarching term that describes a range of neurological orders that are progressive. Dementia damages the nerve cells in the brain, preventing the body from functioning correctly. Each individual is affected in different ways, and the rate of progression varies from individual to individual. Changes may be small to start with, but they could progress to interfere with daily life and activities. Dementia can affect an individual of any age, but is most commonly seen in those over 65. Younger people developing dementia are described as having early onset dementia. The four most common types of dementia are Alzheimer's, vascular dementia, frontotemporal dementia, and dementia with Lewy bodies. The most commonly known is Alzheimer's. Indicators and signs of dementia. Signs and indicators of dementia vary from individual to individual, but may include memory problems, problems identifying new information, misplacing things, difficulty with time, unable to make decisions, unable to follow a series of steps or instructions, visual hallucinations, behaving out of character, restless, reluctant to take part in activities previously enjoyed, repeat themselves or have difficulty finding words, mood swings, anxiety or depression, finds conversation difficult, lack of hand-eye coordination, and apathy. Ways in which dementia can affect individuals and how they experience the world. Living with dementia has an emotional, social, and psychological impact on an individual. An individual with dementia experiences a series of losses. Relationships with friends and family may change, and an individual may be frustrated by having to ask others for support and a loss of independence. An individual with dementia experiences feelings of confusion, which may make them feel angry and upset with themselves and others around them. As a result of changes, there can be a loss of self-esteem, confidence, independence, and social contacts. This could prevent them from participating in activities or hobbies and may also affect their ability to drive. Individuals may become dependent on others to be able to go out and have more limited opportunities to access their local community and travel further. As the disease progresses, there may be a reliance on carers or a move to a residential care. Now, please open worksheet 003, Learning Outcome 12, worksheet 1, and watch the video, A Walk Through Dementia at Home. Living well with dementia. Recent government policy has prioritised living well for individuals with dementia. Living well with dementia supports independence and quality of life for individuals. It supports the importance of remembering that individuals can still live happy and fulfilled lives, make choices, and have their wishes respected. It is important to focus on what an individual can do and enable them to retain as independent and active as possible. The NHS gives guidance on living well with dementia that includes staying socially active, telling others about dementia, looking after their health, tips to cope, and who to ask for support. How person-centered approaches can be used to support individuals living with dementia. Person-centered approaches place the individual at the centre of planning and decision-making about provision. It respects the views and beliefs of individuals and ensures that the individual remains the focus and not the illness. Person-centered care plans are tailored to meet the needs of individuals. Where possible, the individual, carers, and family should be involved in planning. The knowledge of family and carers is important to make sure a plan meets the needs of an individual. It includes aspects of an individual's preferences such as food, clothes and makeup, daily activities and communication preferences. Person-centered planning ensures that individuals with dementia can continue to do things that people enjoy. This helps to reduce frustration, behavioural problems, aggression and depression. The Alzheimer's Society identifies 5 key points of person-centered care for those with dementia. Treating the person with dignity and respect, understanding their history, lifestyle, culture and preferences, including their likes, dislikes, hobbies and interests. Looking at situations from the point of view of the person with dementia, providing opportunities for the person to have conversations and relationships with other people, ensuring the person has the chance to try new things or take part in activities they enjoy. Person-centered approaches. Please pause the presentation here and complete worksheet 003 Learning Outcome 12 Worksheet 4. Considerations needed when communicating with an individual living with dementia. Dementia affects an individual's communication in different ways. In the early stages of dementia, some will be able to communicate effectively, whereas others will have little verbal communication. Individuals may become frustrated when they cannot convey what they want or mean. Some factors to consider when communicating with an individual living with dementia can include background noise. Many individuals with dementia find it difficult to concentrate, and background noises, for example, television, radio, traffic sounds, can all cause further distraction. Approach them from the front, identify yourself, talk slowly and clearly, make eye contact, keep conversation simple, focus on one topic of conversation so as not to confuse, give simple choices, involve them in decisions about their care and welfare, remember they may not recall previous conversations, use the individual's name to remind them you are talking to them, use visual aids and prompts, for example, photos, respond to how the individual is feeling, for example, happy, relaxed and frustrated. Consider hearing or vision difficulties. Individuals with dementia frequently mix up words, so it may be necessary to confirm meaning. Be patient when the individual tries to speak and encourage conversation. An individual may become frustrated if they feel rushed. Use positive body language, for example, smiles or nods. The impact that supporting and caring for an individual living with dementia can have on families and carers. Whilst many family members wish to care for those with dementia, there can be a significant impact on their lives. Caring for an individual with dementia can lead to increased stress, anxiety and depression for carers. The stress of caring may reduce immunity and increase the chance of illness or infection. Carers may need to continue working and caring for other family members, including children, and become tired. Sleep deprivation may occur if the individual with dementia has disrupted sleep patterns and requires night care. Moving and lifting causes back strain. Caring can put stress on relationships within the family. Other family members may not understand the stress caused by caring, and the carer can resent their lack of input and support. If an individual needs to give up work or reduce working hours to care for somebody with dementia, there will be a financial implication. There may be an impact on personal work goals, impact on household bills, for example, increased heating, special foods, increased telephone bills, transport costs, care products, and equipment. Because of the demands of caring, there may be little time to exercise or socialise, leading to isolation and an impact on the carer's well-being. There may be feelings of guilt if an individual with dementia is put into care or extra help is sought. There are positive aspects too, with carers enjoying time with the individual with dementia and comforted by the knowledge that they are caring for them and doing their best for them. Ways in which carers can be supported to continue their role. There are a number of ways in which carers can be supported in their role. A free carers assessment can be carried out for anyone over 18 and can identify ways to make improvements for a carer, for example, training for lifting and arranging breaks. Local support groups enable interaction with other carers and identify sources of help and financial support. Online forums for support and advice if attending a support group is difficult, for example, UK Carers Forum or Alzheimer's Society taking part. Local authorities may be able to provide daycare, respite care or adaptations to the home. Carers have a right to request flexible working hours from employers. Carers allowance gives financial support if an individual is cared for 35 hours a week. By registering as a carer with a general practitioner, the carer receives support such as appointments at convenient times, free flu vaccinations, health checks, information and advice. Charities and voluntary organisations can provide support, for example, Alzheimer's Society National Dementia Helpline, Age UK Advice Line, Independent Age, Dementia UK Admiral Nurse Helpline and Carers UK. What is meant by a dementia-friendly community and how this can contribute to the well-being of individuals living with dementia? A dementia-friendly community is a city, town or village where individuals with dementia are understood, respected and supported. In a dementia-friendly community, individuals will be aware of and understand dementia so that individuals with dementia can continue to live in the way they want to and in the community they choose. Through provision of dementia-friendly communities, the concept of living well with dementia is supported, with individuals remaining part of their community and maintaining their independence, mixing with others and maintaining confidence. It prevents them from becoming isolated and withdrawn and makes individuals more confident in leaving their homes. Within a dementia-friendly community, individuals are supported with aspects of daily life such as shopping, banking, use of technology, using transport and travelling on holiday. Dementia-friendly communities support the well-being of individuals, enabling them to live within their own homes for longer. The communities also support carers as they can be less anxious about individuals leaving the home to carry out daily tasks. Support available for individuals living with dementia. A number of sources of support are available for those with dementia. Care needs assessment. The local authority has a duty to assess the care needs of an individual with dementia. This determines an individual's care needs and whether the local authority will support them. A personal plan will be created based on assessment and will set out how care for the individual will be provided. It includes the personal wishes, aspirations, and care and support needs for the individual. Personal plan will provide information for individuals and their representatives of the agreed care and support and the manner in which this will be provided. A clear and constructive guide for staff about individuals, their care and support needs, and outcomes they would like to achieve. A basis for ongoing review. A means for individuals, their representatives, and staff to measure progress and whether their personal outcomes are met. Other sources of support include general practitioner, practice nurses, social services department, carers, family members, admiral nurses, specialist nurses in dementia care, charities, for example, Alzheimer's Society, Dementia UK, Age UK, National Dementia Helpline 0300 222 1122, specialist support and equipment. Please submit all completed worksheets to your assessor and move on to the next video, Unit 003, Learning Outcome 13, Mental Ill Health. Thank you for watching.